about 200 guests join us via webinar today. And as we're waiting for all the guests to arrive and get settled, let's just take a moment to go over the logistics. So first and foremost, please do connect to your audio using your computer's microphone and speakers, or select Use Telephone after joining the webinar to turn on the sound. Of course, all guest lines are muted to avoid the background noise. At the bottom, you'll be able to type in your questions in the tool, and we'll answer them in the Q&A period. The slides and webinar recording will be sent out to you to share with others. And finally, in the handout section, there is a Willis Wellness Industry Trend Report and Optimity case studies available as bonus downloadable materials for you to bring back and implement in your company. So Optimity, we're a digital wellness platform. We help employees be successful at work through micro-habit training. So what it does is that it really improves their quality of life at work. It's used by organizational leaders to really understand the pain points of their employees' health and thereby strategically target the highest health cost issues to achieve ROI. So it's a fully integrated solution. There's mobile apps, there's wearables, and there's an online portal that really helps you save time and helps you execute your strategies in a cost-effective way. So we have proven results in implementing wellness programs that reduce drug claims, absenteeism, and leave, and helps you achieve ROI between $1.50 to $6.50 for every single dollar spent on wellness. Our customers, therefore, are able to run more initiatives, are able to run them faster and run them easily, and to truly effortlessly coordinate between multiple sites. Our cohesive wellness portal provides you with a database to drive your decisions on how to adapt your programs to truly get better outcomes. So we're very excited to present our clients some success stories. So these include PwC, there's Ontario Centers for Excellence, and CST Consultants. And with each of them, we have dramatically changed the way that they deliver wellness at their organizations and report their ROI. So we have a very dynamic, we have a very information-packed hour, and we'll be giving you the tools that you can bring right back to your organization. So I will be introducing our CEO, Jane Wang. I'll be handing over the floor to her shortly, where she'll share her industry knowledge on data-driven ROI calculations for wellness. She'll be sharing a lot of great facts, and finally some really, really useful checklists to help you get the outcomes that you want. Then I'll jump back in and I'll be sharing some of our digital wellness strategies, and then give you 4 tips on getting the best participation for your initiatives. And finally, we will have a Q&A session. Once again, there is a tool you can upload your questions throughout our webinar today. And if we don't have time to get to it, please do feel free to reach out after the webinar, and we'll be happy to provide you with any answers you support. So I'm Krista. It's lovely to meet you. I am the advisor for corporate wellness strategies at Optimity. So my background is in nutrition and health promotion for corporate programs, and my work at Optimity is mainly to help clients customize their programs and strategies to target those high-cost issues and to really drive home better outcomes. And I'm happy to introduce Jane Wang, the CEO of Optimity. Jane has an extensive background in global clinical trial management and preventive disease flagging, which has then became the backbone of our award-winning Optimity technology. She also leads our analytics practice at Optimity and is responsible for supporting organizations in achieving ROI in wellness. And most importantly, she's responsible for changing wellness from a nice-to-have to a true need-to-have for organizations to control cost escalations related to health. Once again, I'm so happy that she's joining us today from San Francisco to share some of the best practices and lots of knowledge on what truly drives ROI for wellness. So Jane, I'm ready to learn, and are you ready to get started?
Let's do it.
Awesome, great. Okay, so what we'll truly be covering today is Jane will give you the key takeaways for what she'll be covering.
Okay, perfect. So we'll begin with a quick summary of all the different parts, and then we'll dive right into it. So a lot of the takeaways that I'll be sharing is really the best practices from 2016, from lots of clients on really focusing on a more data-driven way to achieve ROI. So the first thing I'll do is that I'll go through some definitions and facts on ROI calculation. And then we'll go through specific case examples. I have 3 examples prepared. They're for the large organization, the mid-size, and also the small. And it's quite different. It's different ways to really implement something that's uh, attainable and also practical for that organization. We'll talk a little bit about why ROI calculations are very important, especially in getting budgeting and making sure that this is a C-level supported program. And the last thing is that I will go through a checklist for you to achieve ROI, using whatever tool you currently have, or if you want to upgrade to a digital, how to do that.
Mm-hmm. And then I will then share how a digital holistic platform like Optimity can help the HR managers to engage and support their employees. I'll talk about how digital solutions can help achieve this and share some best practices with 4 tips on how holistic health can be scalable for you and your organization, and how data can be your friend and support continuous improvement in your wellness practices.
So let's start with some top industry trends. I know Trista mentioned this already, but in the handout section, we do have a couple of great industry reports. There's a RAND report there. I also have put up the slides from our popular December web series, so that one, so you can download them and go through it with me as we go. But really in here, we're really finding with organizations, a lot of the leadership is holding HR accountable for business results, right? So it's not really looking at it as such an administrative task, but looking at it more strategically. And because of all the HR technology that's coming out, it's really making data-driven decision-making possible for organizations of any size, because no longer do you have to hire additional people. You have the tools to do with what you will really actually even just save you time in what you do. And when we go and look at specific results for HR, we're finding that there is a spectrum of responsibilities, and wellness is becoming one of those pillars of responsibilities. And Optimity, we're a specialized firm. So specifically what we do for wellness in organizations is bringing it down to a level for which we look at drug claims, we look at benefits to really target content in a way that's practical for the employees. And I'll talk a little bit about that. So the top wellness trends, I'm hearing really 2 big schools of thoughts in 2016. The first one being the school of digital health coaching, right? Really going mobile first, really thinking about apps, wearables, syncing, Internet of Things. And the expectation from the employees too is that it's personalized delivery. So in order to get people to really truly engage, and it's looking at, okay, is it actually personalized to me? Is it things that really matter to me? It could be care of an elderly at home. It could be dealing with pregnancy through as you're going through your work, as you're maturing in your career. And it could be as traditional as smoking cessation and things like that. But really looking at health on a holistic spectrum. And you really have to look at the different costs of different things. And digital makes it really easy to give a scalable solution without adding additional costs, right? Like spending $300 per head on a smoking cessation program and then adding $2,000 for all these people who are really interested in mindful meditation, really kind of bringing all those costs down by centralizing it together. while you're kind of doing that type of centralization, you're also enabling yourself to have one pool of data. When you have one pool of data, what you can do is you can standardize that and you can do analytics on it. So engagement is the first start of measurement within wellness, right? Participation, engagement, we talk about that, but that's the beginning, right? Because now the whole wellness data pool is becoming this big data type of, the quality of it, the number of it is really allowing the people like myself who are, data analytics people to really love on segmenting the different types of users and being able to provide personalized programs for them. And it allows C-level sponsors to see a lot of true metrics on true returns and results. So going forward into a little bit of how the costs are broken out. The employee health cost comes in a number of different flavors. We really talk about, the premiums, the benefits. We really also look at absenteeism. We like anything that you can track. We look at year-over-year increases in drug costs, definitely, and this is by far a lot of times something that's going out of whack in most organizations that we work with. And then lastly, we, of course, as your population is aging, all of these numbers are going up. So we really have an epidemic here where the costs are escalating every year, and it's not unusual to work with an organization where the average absenteeism days is 14 days, right? And then you have to bring that back down to single digits, or the year-over-year increase truly is about 40% even for the drug costs, but then the benefits company help you negotiate that so that you're actually getting 20%, but it's still a crazy difference in the premiums and which pools that you're actually paying for. So the total cost to businesses across North America, we work both in the US and also in Canada, it's over $1 trillion that businesses are spending. And in the new government, the new Trump government as well, yesterday I just attended a talk here in San Fran, and we were really talking about what is the implication on employers in terms of health costs with this new government. And it's I think the simple thing is that the costs are going up, and more of it will be, the burden will lie with employers. So now that we understand a little bit about what the big picture is, let's bring it down to a firm level. Let's look at how do you become strategic and focus on outcomes and being part of this conversation of the value-based care. So let's start with the different factors. I think so the first one that we look at, very quantitative, is drug claims, right? It's a really good picture of what's happening now. It's also a very good way of measuring because that is almost immediate. So we're finding that with a lot of organizations for which we bring in a targeted program, it's have an almost immediate impact on some of the drug claims. So this could be like 6 months into the program, you'll see some of the differences, especially for back pain, especially for things that you can impact. Other things in here are like benefits utilization. We do see an increase in utilization in paramedicals. And when you really kind of look at both drug claims and benefits utilization, you'll be surprised to know that not only is the band of the people who are using it the most, most people think like 50 plus, right? 50 plus, that's a group that's using a lot of drugs. Not true, right? The other strong growth area and a big chunk of it is in the 19 to 25 group, these millennials, and they are using things, everything from antidepressants to paramedicals, and it's actually a lot of the big chunk of the cost. So don't be surprised if you have a relatively young workforce and your drug costs and benefits costs are also escalating, and that's really, really normal. And those two sides of this kind of bimodal hump is what's contributing to a lot of companies' problems. Other things, stress leave, sick leave, STD, LTD, yes, we watch that very closely, especially STD. It's important to have like good back to work programs. Absenteeism is a really good measure. It's a very good like pre-indicator a lot of times of people quitting, which then goes into turnover, attrition. And then when you look at all these different types of numbers, you're already kind of being a lot more strategic. You're like, okay, well, do I know my numbers? That's the first thing you need to look at. January is a really good time to look at your past year's data, and we can also help you do that. But it's quite simple. When you look at that, you look at your trends year over year for the last 5 years, 2 years. Then you look at, have I ever tracked ROI for the current wellness initiatives? Because you are spending money in this, you're spending energy with this, and a lot of times most wellness programs are feel-good programs, right? And I totally love feel-good programs, but I also like feel-good programs that have a true impact on people's quality of life. So I'm going to go into a little bit of science behind how you should approach thinking about numbers. So the first thing I'm going to explain is really the phenomenon of anti-selection. So what happens in most traditional wellness programs is that, it's a feel-good program, and then all the super fit, the people who are already very attracted to wellness, come and attend them. And that's not really helpful because those people are already healthy. So they're kind of just using the benefits there, but it's not really kind of reducing any of your costs to absenteeism, right? They're already engaged. And then on the other end, you have your disease management program, which is super important, but these are usually for the people who are already kind of sick, and oftentimes they're already on their way out of a productive workforce. So it's important to take care of them, but you're finding that you're spending money on programs that are kind of on the fringe, and where most of your cost is actually coming from the middle majority. So one of the big difference between being, very statistical and numbers driven is that Optimity really focuses on the middle majority and understanding what your middle majority is. And this is the 80% of your people who the bulk of the actual prescription costs, the benefits utilization, and the absenteeism costs are coming from. And you're really looking at programs that could involve them, right? And it's not just a fringe of like, let's all train for a marathon. This is not the objective of the program. The objective of the program is to reduce the burden of their daily intake on prescription drugs, dealing with, pregnancy, dealing with elderly at home, dealing with their own health issues. Okay, so moving on, I think participation is super key, right? So I talked about the middle majority, and I think for you too, whether or not you have a great program, or you're just starting a program, it's really important to first focus on participation, and that's what we do. So our average participation for 2016 is actually up from one we had last year. So in 2015, we had 74% participation averaged across about all these companies, but in 2016, with over 112 companies, we're at 77% participation, and that is the most important thing. So this comes from the strong effort of internal marketing, right? We have a full client success practice where we really take care of how to onboard these people, and onboarding is very, very important. So for you, think about how you're onboarding, and if you need help, of course, reach out to Tristan. She'll definitely forward you a lot of the resources that we have. Once you have participation, then I think the next thing you need to focus on is how to kind of customize it and use it for you. So I'm going to talk a little bit about PwC. Oops, I think I pressed one too many. I'm just going to go one back. There we go. So in terms of employee participation, you got them there, but you have to think about what's keeping them there. So that's one thing that digital does very well. Right, so when you're onboarding, hundreds and thousands of employees, instead of you using the spreadsheets, this automatically tells you, oh my gosh, 20% of your people are doing brain challenges, doing social, and that's what we're finding actually with PwC. We worked with their audit teams during busy season. These people traditionally don't come to any lunch and learns, right? They're so busy. It's kind of a culture of like high achievement, but at the same time, people drop like flies and people leave after, right, because they're burnt out. So I think it's really important to look at what people engage with. So they looked at their data over 3 months. We really customized it with them because it was so easy. All the numbers are there, and they turned on a lot of stuff for social. They did things, team lunches. They did a scavenger hunt. They did all these little things that really doesn't take any of the consultants or the accountants very much time, but they made them feel connected. And it also provided them with a lot of medically and evidence-based science that is supported by Mayo Clinic, So all that together brought in their participation, and they hit over 72% participation within 3 months. So good for them, and it's a very, very good job for a large organization. Okay, so let me explain why it is important to kind of bring the content to the employee, because a lot of times when you're busy, it's really hard to take half an hour away for a workshop, right? And sometimes it's not effective because a lot of times after the workshop, you're not able to bring it back with you. So we provide a pocket coach. It has a lot of all this content. I think the most important thing is that making it micro and syncing with the calendar so that we are taking care of fitting all these little activities into the employee's workday. And I think you need to think about that too, because in order to achieve ROI, you must achieve high participation. And if you don't have high participation, and if you don't bring it to that employee, you're going to have problems, right? Because the theory is there, the evidence, science is there, but if people are not using it, they're not really getting anything out of it. Okay. Admin control. So let's start with kind of a checklist of things that you need to look at. So claims insight, looking at your past claims, looking at what your dollars are being spent on in terms of what are your 5 most costly drugs, and what disease areas are they addressing. Okay, looking at what are the highest growth areas of drugs, and then customizing your pocket coach for your employees to address those issues so that we can really target that. There's a really great case study we did with a client. I think it's on the website under case studies as well. It's really around a targeted program towards back pain. And a lot of their drug claims is coming from pain management medicine. So by implementing a lot of stretches, back stretches, little activities that you can do to just like alleviate pain throughout the day, it actually had a really huge impact on their drug claims, because this was a big chunk of where their costs are coming from. Another thing is incentives management. People really talk about rewards, they talk about gamifying and all that stuff. Here, I think to get a good ROI is really taking all the hours and admin out of it. So whatever your budget is, it could be as little as like $1,000, and it could be whatever your actual budget is. Just whatever that is, put it into a system where it's automatically managed for you, and let that be, because a lot of times I find that people are spending a lot of time, personally managing, delivering cards, coming up with ideas. I think it's much better to just give it to experts to do that. And then the population analytics on risk. There is a really tight relationship between health risk assessments on our platform and how insurance measures risk. So I'm going to talk a little bit about that on measuring ROI. Next. So, okay, we talk about one of the biggest costs of management is actually kind of hidden. So a lot of the cost of managing a wellness program and getting the ROI is actually the amount of hours or the amount of fragmentation you're actually spending. So not only are you spending, there's companies that we work with that have these social budgets that they're spending on everything from fruit to bringing an expert in, to doing offsite days, and these are all really great, and I think you should continue to do that. But it's not great to put out these fixed costs or random costs here and there, and then have 10 people show up, right? That's what I have a problem with. So by actually bringing that all into one centralized, management system where you're getting announcements, people are actually engaged with it. It's in their calendars, they see it, the attendance goes up, right? So with OCE, that's exactly what they did. They are only 2 ladies running, 7 different offices all across, and with them, they were able to run so many more initiatives, 3 times more initiatives with less effort. So we've saved them a lot of time, 150 hours, I think, in their first year. Really, really good. So if you really think about how you can help your company, you can help, we help with that too, but you can really help it by looking at the baseline claims, right? Baseline, doing a cost analysis to develop the top issues, to understand what those are. You should really look to reduce the drug benefits cost of unhealthy employees. And a lot of times it's kind of really, looking deep and applying the knowledge, just kind of understanding where those drugs and what are the conditions that they map to. And then looking at the absenteeism number and turnover numbers, and that's where the ROI comes from, right? A third of it comes from drug reduction, the actual true hard cost of what the claims and the benefits costs are coming for you. The second one is really kind of reducing the admin burden that it takes to run programs, and the third one is talking about all the other type of absenteeism, turnover, all the other a little bit softer part of it. So Optimity is able to kind of help you boost a lot of the engagement, have more visible benefits. These are all lovely soft things too, to reduce the admin time as well. So I'm going to go now into, I know this is a little dense, so feel free to ask any questions so that we can kind of address them directly. So this is with a large enterprise, it's about 2,500 employees, and this is how they really approach at looking at how they would invest in wellness. So for their 5-year plan, they've decided, and this is prior, to like talking to us, this is like their own investment. They thought, okay, we're going to invest $3.2 million into doing all these things, and I think they're wonderful. So it's, really introducing a flex benefits plan, looking at employee health reviews, right? Making sure that they have the right chronic disease management programs for the right price for that scale of employees, negotiating on that, putting together a disability management program that they're happy with, that has been giving them results. Bringing in a little bit more incentives, right? More incentives for the employees, for them to kind of participate and to boost and kind of nudge them into the right direction and to get those resources. Mental health, that became a big thing because when they did the analysis of their own drug claims and costs, mental health came up. A lot of new costs to it, a lot of new absenteeism because of it. So adding mental health as support. And incorporating an online as well as a mobile wellness platform. So that was one of their new things. And implementing a strong communications plan. They've really budgeted for the hours that it would take for their benefits, the HR department, to put together a strong communications plan internally and also externally, and then creating an executive dashboard. So they actually also contracted another vendor. So this is actually a collaborative effort between about 4 or 5 vendors that they work with. We play a role within this too, but this is kind of a collaborative effort between a lot of vendors, and they're looking at this bigger improvement. And what they're looking at is really, what is a hard savings and what is a soft savings? And what they classified as hard savings is, the program design costs, right? Can the vendors help us reduce that? The admin operational costs of like actually running these programs over time. The number of disability claims, the duration, has that changed? What is the specific dollar associated with that? The drug and medical consumption, what is that actually changing on a quarterly basis? And then the other soft savings are towards absenteeism, turnover, cost time in recruiting, productivity measures. And then so they're already 3 years and a little bit into their 5-year investment, and right now they're really, really on track for getting that return investment back. So the calculation from December is they're getting $13.8 million back for that $3.2 million investment. So that ROI is calculated to be 4.3 for this larger organization. And this is really good because if you compare this to the studies out there for wellness, 64% of wellness programs have no ROI. And most wellness programs can only state and calculate an ROI after 3 years, and the number is usually around $1.50 for every dollar spent. So I think a lot of times it's not because the wellness programs don't work. I think it is actually because the wellness programs are not tracking the right data. It's hard for it to track, and also you're just not getting the participation that you need. So for this organization, they are, they boost their participation. They're above average, so that's really great. So let's kind of shift gears and look at a different organization. So this is a mid-sized organization, and I love the mid-size, and I think this is where a lot of the opportunity is, because it's actually it's very underserved, and a lot of people are doing, programs that are kind of born in the 90s, and this is where you can realize really big savings, really big dollars, and this is where we achieve the biggest results and the best. So 2-year investment, a much shorter term investment. Of course, planning is different for different size organizations, so they do a 2-year planning cycle. They invested 150K into the program, so 70K, 75K every year. It's dominated by our platform. So it's a comprehensive online mobile platform. They did opt into incentives. They do the health assessment. They do offer holistic health support. So they do utilize almost the full library of content that we have. They do have also included the content for chronic disease management and disability management. So that's awesome. So this is all done with one cost, right? So that's the really great thing about kind of the mid-size. And then they changed. One thing I love this company. So what they did is that they did a lot of targeted cultural initiatives to get that participation up. Their participation in the high 80s. It's wonderful. And what they were able to do with that, and the reason that they kind of brought that up as a highlight, is because they wanted to reduce absenteeism and turnover, because they have remote staff. They have about 100 of their salespeople that are just all over the country. So it's really nice to see that they're doing kind of a targeted cultural initiative where they're kind of bringing in all these people that are working from home, and now they get to see each other's faces. They get to do theme challenges and get to know each other a little bit on a different personal level. They also implemented a strong communications plan, followed really our internal marketing guide to a T, which includes a 3-week pre-launch plan. Really, really good. They were able to get to over 50% sign up within the first a couple weeks. It was very, very strong. And of course, they have an executive dashboard which they can view. So it's part of the admin view. They get to see that. So for them, they really only worked with a couple of vendors, and it's wonderful. So in that, we are able to help them track the biggest savings they're getting via the medical claims. So a big increase in their ability to report on what the ROI is. So for their drug claims, they were really going up year over year, and we were able to kind of bring that down to less than 30% of what the increase was. A lot of the program design costs just kind of evaporated because we help with designing all that program. It's a managed service. With our admin operational cost is abysmal. The number of disability claims and duration also has decreased, which is wonderful. But in their soft savings, okay, so their turnover changed, which is really nice, and a lot of that is actually coming from the remote workers, which is completely understandable because it's directly related to that targeted cultural initiatives. So everyone has a mobile phone, everyone can sign in. I guess it kind of brings people together, especially when you have over 80% of your people on it. Absenteeism also got better, cost of time in recruiting, and productivity. So altogether, so far they've got almost $1 million in savings, which is just so amazing. I think next year they're on trend to probably even do more as they grow a little bit more as well. So their ROI is 6.5%. $6.5 per every dollar spent. Such a stellar case. Good job. So we also have a number of clients that are smaller employers. We have some companies that are much smaller, 60 employees and things like that. And we're starting to distribute a lot through regional benefits advisors and brokers. And I think we're going to be able to reach more of these smaller employers this year in 2017. Usually they plan only about a year in investments, and it's a much smaller investment. It's about a 15K investment, but I think it's still very much worth it because we have lots of cases where you really see a lot of the savings right away. So you're able to kind of bring in the same type of program, of course, without adding an additional HR headcount or anything like that, and really run amazing world-class programs with the same resources. So I like these guys as well. They invested 15K just for a year, and then so far they're at 31 as of October last year. So this year, perfect, same trend. I think this is another just a different set of numbers, and I think it's a good thing to benchmark yourself against to look at where do you fit, where do your clients fit, and things like that. Okay. So I want to talk a little bit about the difference between US. So a lot of the examples that I've shown you, so some of it, so some of them are Canadian, some of them are US, and there is a difference between the costs between Canadian and US. So for a lot of the Canadian clients, we're seeing about $1.80 to a $2.50 back. So this is kind of the difference in the ROI numbers. And for the US ones, they're usually bigger. They're usually between like 3 and 6%, 6 times ROI for every dollar spent. So I think there's definitely a strong business case for both sides, but it's good to kind of differentiate the two. We also have a promise for the first year. So I think it's really, I want to make it a no-brainer for you to really invest in wellness in a need-to-have way, in a way that's very convincing for your CFO, because I'm finding that, once you get the hard numbers in there, it's really easy to get C-level support for what you do. And we see a lot of CEO-led programs just like CST that I was just showing you before, and they're wonderful. So we do have an ROI promise. So Optimity promises $1.50 back for every dollar spent in your first year. And if we don't achieve that, we will refund you for the difference. So this is, I think it's, making it really a no-brainer way for you to do that. I do talk about how a lot of programs have no ROI. I don't think it's because they don't achieve it, but I do think it's hard to quantify it, and a lot of it's not being heavily adopted. So I do want you to read some of the studies. They are in the handouts, so take a look at them. I don't want to restrict you to just digital programs, because I think digital is a supplement to a lot of the in-person cultural things that you must do as well. So I want to kind of highlight some of the partner results from all types of different programs. And this one is actually through Excellence Canada, and it's really implementing their program. So you're able to achieve a lot of quantitative things too. So make sure that you're tracking them, even if you're doing in person or whatever it is that you do. So quantifying it by a reduction in absenteeism, a change in sick leave, just an increase in engagement, right? So let's say last year you spent $25,000 on an initiative where you know that you only had 12% engagement, right? This year, if you can take the same $25,000 and you can get to 30% engagement, that's awesome, right? That's a really dramatic increase. So whatever tools that will help you do that, or whatever practices, and I'm sure Trista has lots of really great recommendations from like working with clients all the time. So I'm sure that there's lots of resources within your community and within our community that could help you. All right, so I promised you a checklist. So I'm going to go through the checklist one by one. So the first one is to gather your historical numbers, right? Look at your historical numbers for drug claims, your absenteeism, your turnover, your SCB LTD claims. Go look at them, right? Go get that report generated. A lot of them is at no cost to you. It can be done by your benefits advisor, by consulting firm. Great, do that. And if you need help, email them to Trista. We can help you with that as well. And then the second thing is that from that, understand what your top 5 issues are. You don't have to solve everything for everyone, but most of the times if you solve your top 5 issues, that's 80% of your cost, right? So understand your top 5 health issues within your particular employee population. Okay, so now you have those 5. Your next step is to identify initiatives specifically for those 5 issues, right? Again, don't say, oh my gosh, mental health is so great, everyone's doing financial wellness. Of course we offer all that in a library you can choose, but before you look at the library and get excited about all the shiny stuff, go look at the ones that actually target your health issues, right? So look at the drugs and then map them to whatever the health are, and then identify those initiatives and tools that will work in your work setting, in your specific type of company structure, how many sites you have, what type of population you have, what do they like. And then calculate an estimated ROI. So whatever plan, it could be a 2-year plan, it could be a 5-year plan. Calculate what type of things you want, what are the traditional costs to them, and where do you want your numbers? Where do you want to take your historical numbers plus your trend numbers? How much are you going to save? And just calculate that estimated ROI for you. We have an ROI page specifically on our website. Trista's going to introduce a little bit later. She'll share the link. And we're also introducing an ROI calculator, so you should be able to do this yourself as well. And then get C-level buy-in. So once you have that ROI, you're armed with that number, go get C-level support. Say if I'm going to spend this $25,000 here, I'm going to get you back $50,000, and that's really worth it, right? It pays itself back within 2 years. That's awesome. Very rarely any investment out there that can do that right away. So this is a really good, numerical way to get that C-level support, and that will give you the budget, the resource to do that. And then once you have all that, then engage partners, right? You have your C-level support, you have a plan, you have your top plan, it's focused, it's not taking a lot of time, and then now you engage partners, right? You decentralize the implementation, because the more, we see this in organizations all the time, there's multiple admins that kind of run the program regionally. It's very easy, it's collaborative, but then as soon as you have that, it's part of our secret sauce, you get, each of them have their own circle of influence. So each of them will bring in the people that they listen to them, that they work with, and then all of a sudden, within the first 2 weeks, you're going to have 50% of your people sign up. So it's really important to engage partners at all levels. This could be regional managers, it could be the office manager somewhere. I've seen receptionists have great influence over how many people sign up. So, don't be afraid to engage with all kinds of partners throughout the spectrum of the organization. And then you can just go get it and go get that ROI number. And you're going to achieve much higher returns to every single initiative that you have. So the last point that I have is that now that you've gotten there, my last point's not showing up. Oh, there you go. So the last point that I have here is to really track results. So you're not done, right? Now, you promise someone the ROI, you got the budget for it, you have all the partners. Now it's actually tracking it, and this is a hard thing to do. I know everyone's busy and other things come up, but tracking results quarterly to ensure that the ROI is actually realized, that you're on track for doing this. And once you have this, it's a virtuous cycle. Once you get into the habit of this, we talk about habit formation. This really will change the way that you approach not just wellness, but a lot of the HR initiatives. And, you can take this back and really apply that principle to everything. So, and of course, if you work with Optimity, we actually take care of all of this for you. But I want you to be able to use this with or without technology anyways. Okay.
Mm-hmm. All right, thank you so much, Jane, just for sharing your expertise and your knowledge around wellness and just giving our audience a great checklist to help them get their outcomes. So I'm just going to jump back on right now and just talk a bit about Optimity, what we do, my experiences working with our diverse clients, and just some best practices and strategies that we've developed over time. So at Optimity, we work to support you with a gamified and fun solution for workplace wellness. We work with Fortune 100 companies to create good practices to improve the employee's quality of life at work and also drive down the risk for chronic health conditions. So when I work with clients, I do see the classic problems in modern employee success practices for the wellness managers. First and foremost, I see multiple demands, both from the leadership and from the employees. So I'm hearing lots of ideas, and they're really, really great ideas. However, it's just very hard to prioritize. I see that it's hard to coordinate. There's an increasing amount of dispersed workforces, employees, they're working more flex shifts. A lot of organizations now, they have bimodal age distributions. There's millennials, there's baby boomers, and they all have different preferences. And you really need to find a way to serve different needs to keep wellness accessible to all parties and all employees in your organization. So there's also lots of changing requirements, such as the new need to provide mental health support and also for financial wellness education. And finally, there's just a high employee to HR ratio. I'm sure a lot of you are experiencing this right now, that you're just expected to do much more and serve a lot more employees with much less resources. And finally, there's an increasing demand on becoming more metrics driven. So as a result, you may be using more spreadsheets. I see a lot of clients spending hours sending out emails, calculating things on spreadsheets, when really what you need is a centralized dashboard and automatic smart analytics. And that is exactly what we help you with at Optimity. So basically, we make your life easier and help your people get healthier. So we help organizations achieve better health outcomes, both at the employee level and the individual level, as well as the organizational level. So Optimity digital platform works because it helps bridge the gap between the strategies and the implementation. So you can support the employees to adopt healthy activities leading to better health individual outcomes while transforming the organizations into healthy workplaces in a scalable and in a unified way. So this is what we do to drive true behavior change. So let me explain how the Optimity platform works and all the components of our ecosystem. So we have a customized mobile app that's available in 3 different languages. It's accessible on any mobile platform. There's also a desktop version as well. We also connect to 250 different apps and wearables, so we can help the employees really leverage the technology that they're already using. Of course, we also provide our own wearables as well for employees who may not have their own. And finally, our centralized dashboard, it allows you to see real-time data and truly easily implement your holistic wellness practices. And on top of this, we have advanced analytics that truly helps retarget specialized health contents. They're all science-backed to help address your highest health cost issues. So today, I'm just going to share some of our secret sauces and the best practices that we've developed over time in helping clients achieve high ROI and help you get that same ROI. First of all, many of you guys have experienced that engagement is often just the first hurdle. Relating back to what Jane said in terms of anti-selection, you're not truly engaging those employees that are driving up your health costs. So today I'm just going to be sharing 4 tips that can truly help you get more participation and more engagement for your wellness initiatives. So the first tip is just going grassroots. It's quite simple. The first tip on boosting engagement here you can do with or without technology. So the Optimity system allows you to recruit support. It allows you to recruit those champions across the organization that is truly needed to create grassroots initiatives. It helps you build a leadership culture within the staff, so having that in-person touch really truly helps push a wellness program forward and make it more effective. And finally, our platform helps you go grassroots while decentralizing the effort it takes to recruit and sort of connect those grassroots champions. However, it centralizes the coordination and the results, so it helps you save hundreds and hundreds of hours in admin work and just makes things much, much easier. My second tip is to go mobile. everyone has a smartphone these days, and people are continually, once again, working more flex time from home. People are working at different hours, and they're just generally on the go. So by implementing a bring your own device model, you'll be able to help your employees get the right information at the right time, and also just move off of those email notifications. Wellness emails, they're just a thing of the past. They rarely get checked, and they especially rarely get actioned upon. So a system like Optimity is helpful because it helps bring it to the mobile and wearable, actionable items. It helps reduce, the clutter in emails, those spam messages, and it truly reaches employees by their mobile devices through 24/7 access and gives employees more health boosts while also giving you more data. My third tip is to go mini. So big changes for your health, they can best be achieved through small nudges. We're all very, very busy, so you must go small. And just think about how successful Twitter is in their, micro messaging and how great it is for getting the word across. We've taken that principle and applied it here through our micro actions. So the smaller it is, we've found that the more likely it is to boost the likelihood of the user taking action, taking these health actions. So by going mini, you can capture the attention of the busy, as mini only takes minutes throughout the day. You can truly boost your engagement and know that the science of the small steps will lead to large impact. So these micro habits over time, this is what leads to the macro results. So Optimity offers hundreds of micro habit content that's made specifically for this. And lastly, my fourth tip is to be data-driven. So go get your metrics, go get that expert support, and truly improve and customize your program over time. As HR professionals, you're already doing so much every day to truly drive the success of your organization. So it makes complete sense in a strategic manner to take that view on wellness as well. So what I'm saying is set those KPIs, consult with advisors like Jen and myself, because we're here to support you, and we're truly happy to help. And it really takes time to get good at this, so see wellness as a process where you can use the tools and the checklists and the KPIs to customize your offering over time. Once again, we're very happy to support you on your journey and to help you get started. And we're both so lucky that this is such super rewarding, and just to see the results of our partners and to see the results of our clients and truly help improve lives. So Jane, how about we do a quick recap for our guests with our main takeaways?
Yeah, I think that's always good, to reinforce. So the big parts that I went through with the strategies is really, providing definitions and facts on how to calculate ROI. I went through 3 case examples from 2016 from different client sizes and how they calculated ROI and specifically what numbers they had. This slide deck will be available as well, so you can download this and kind of, use that to build your own numbers. We talked a little bit about why it's important to build this type of numbers so that you can get the leadership support and the success that you need. And then I went through a checklist to achieve your own ROI, so I hope you do use that and give me any feedback. And I love hearing stories of how people are implemented it. It's always super nice and warm. So yeah, that's what I went over today.
Mm-hmm. And thanks, Jane. And what I went over is that I shared how a digital holistic platform like Optimity can help HR managers to engage and support their employees. I talked about how digital solutions and best practices. I shared 4 tips on how holistic health can be scalable for you and your organization. And finally, I shared how data can be your friend and support your continuous improvement in your wellness practices. Thank you so much for joining us today. And if you are looking to boost engagement or to just launch a targeted program, or if you have any questions about the Optimity platform, ROI, anything wellness related, please do reach out to me at tchan@myoptimity.com. As you can see, my email is listed here for your viewing. And if you'd like to read more about ROI and read our case studies, please do download them from www.myoptimity.com/ROI. So we've shared a lot of great practices and industry trends today, and we actually want to help you take this home to your organization. We want to help you make a business case for this, and we truly want to help you create a strategic program. So please do come take advantage of our January promotion. We're offering free historical claims assessments. With Optimity, we can help you figure out which pain points that your employees are feeling and help you create strategies to truly reduce those high health costs, to truly instill healthy behaviors in your employees and drive them better outcomes. And I know Jane previously touched upon this, but we're so excited that we're actually launching a ROI calculation tool on our website next February, so the upcoming month. And please do come check out our website, come calculate your ROI and project what sort of savings you can be achieving. So it's something that you can do yourself very quickly on our website.
Trista, aren't you also doing another guest webinar in February with wearables?
Absolutely. So we're having an upcoming webinar with representatives from Amazfit. So they're part of the Xiaomi edition in China. So they have beautiful wearables. They're actually the second bestseller after Fitbit worldwide. So we're very excited to have these guests join us and talk about wearable technology and how that's the future of wellness. So please do join us for that. We'll send a personal invite to that webinar, and I look forward to seeing you there as well. Okay, so thank you so much everyone for joining. We'll be sending over a recorded webinar as well, and please do download those downloadable materials that I spoke about previously, and I'll see you at our next webinar. Thank you so much, guys.